I'm not going to go through very detail on each disease because some of it is something that you will encounter during your practices or if you are doing poultry. And then you may not, some of the diagnosis is quite straightforward. And then some of them doesn't require any treatment or anything at all. Or only some of them require intervention or prevention programs. Okay. Okay. Before that, please review your uh, musculoskeletal anatomy because it's quite important for you to understand whatever I'm gonna talk about in this lecture. Okay, especially all the bones and some muscle parts and tendon parts. So because it's quite important because some of the term if you do not understand your anatomy, okay, you cannot recall your anatomy, is going to be quite difficult for you. So as you may see here, avian's anatomy is quite unique. Okay, it's quite unique. Basically, all their long bones are hollow bones and they can easily fracture. And then some of them, they have quite unique in comparison with mammals. You can see here the back here, they are this synsacrum here. It's all fused together. It's unlike the mammals where all the vertebrae are separated. So all the bones at the back here are all fused together. And then they also have 7 cranial bones and the rest. Radius ulna becomes the wing, and then few others lah. And then they have the breast for the breast muscle here. Okay, I think not much. You just have to review your anatomy, how the uniqueness of avian anatomy. Okay. In general, the leg deformities and lameness of poultry or avian in general, they are commonly found in males due to their rapid growth rate. It basically, deformities and lameness has been increasing in nature because of the genetic selections. Okay, because over time, if you remember back in the days when early 1900s, we it took probably 6 months to reach 2 kilogram, the one that we have right now. And then through genetic selection, we have to selected a better breed. And then when we select better genetics, so that they grow faster. One of the setback is the musculoskeletal problem because sometimes they grow too fast. They grow too fast. The bone and the muscle grows disproportionately, and then it leads to a lot of musculoskeletal problems. Okay, this is a bit of balance lah, and then so slowing growth between days 15 to 20. This is in broiler basically. Slowing growth between days 15 to 20 reduces incidence of diseases by 70 to 90%. Not just broiler, I mean all breeders as well. Slow growth in turkeys is quite ineffective. However, increased exercise after 6 weeks may reduce lameness problem. Okay. When it comes to leg deformities or musculoskeletal problem, we can classify into different causes. Okay. And number one is growth and environmental related leg deformities. And the second one is physical or mechanical causes of lameness and musculoskeletal disorders. Third one is toxic causes of lameness. Number 4, nutritional problem. And number 5, infectious causes of lameness. Okay, let's go through the number 1. Growth and environment related leg deformities. We have some of the diseases. We'll go through one by one. Number 1 is spreader or splay legs. Okay, this is something that you may see at the hatchery level only. Usually, in this kind of things, the chicken will be cut as soon as you see them. Okay, once they hatch, you see all these one display legs, they will be cut at the hatchery. Usually it won't you won't see them at the farm level unless we also have a lot of cases also, unless the supply is so little, the demand and the demand is high, and the supply cannot provide or whatever the demand is. Sometimes they just give whatever they have to the broiler farm. So some of these chickens will end up in the farm as well. Okay. This is due to prolonged struggle by chicks to emerge from the eggs. They're hatching into slippery space, especially in the hatchery. If you didn't put rubber or anything there, they just slip and then cause splay legs. Affected chicks and unable to rise, basically they just sit down. One or both legs are extended in front or to the side. Toes are usually contracted, like curled toe like that, and should be cut at a hatchery level. That's why I said just earlier. Usually these kind of things, when you see them once they hatch, before you transfer them one by one into the box, before you send them to the farm, you should cut all these one with splay legs. But sometimes they still end up in the farm because because those selecting the chicken are humans. There'll be a lot of human errors as well. So this is how they look like. So usually all the chicks in the box, you'll see some of them will look like this. Okay, usually you should supposed to cull all these, but you shouldn't let them end in the farm. Okay. However, if they end up in the farm, it's not they still survive. It's not a problem. They still survive. It's just that most of the time they usually slightly underweight. Okay, they're slightly underweight. They are like the OKU chicken. Okay, they're slightly underweight, and then they will grow. It's just slightly underweight. You will see them if you go to the farm. If you walk around the farm, you will see some of the chicken that they look like this, and then they just grow normally. It's just slightly underweight, and that is how they look like if in the farm. Okay, they end up one of the legs is play legs like this. Okay. Secondly, is crooked toes or curled toes is common developmental abnormalities found in young growing chickens and turkeys. They're usually affecting only a few birds in most flocks. Not much of a problem. It's increased incidence in infrared brooding because they say it's because if you do infrared brooding instead of the normal lamp heat or the lamp, it's supposed to do for the brooding one. Infrared was say that infrared could sort of like destabilize some of the vitamins and minerals in the feed. Okay, it's called some nutritional problem as well. They either deviated laterally or medially is the toes. Okay, this one is medially, this one is laterally. Curled toes can also be a result of riboflavin deficiency in younger birds, so differentiation between these two conditions is important. Next one is spondylolisthesis or kinky back. This one you'll also see once a while. It's like a spontaneous problem kind of things. Is due to downward rotation of the fourth thoracic vertebral body leads to the pinching of the spinal cord and leads to paraplegia. Why fourth thoracic vertebrae? Because in chicken, fourth thoracic vertebrae is the mobile vertebrae. It can sort of can move and is easily rotate or like pinch down. Is said is have some hereditary predisposition, more common in females than males and rarely found in turkeys. Must be differentiated from scoliosis and other diseases of the same vertebrae which causes similar neurological signs. Even in human also, we also have spondylolisthesis, kinky backs. Those if you some people who are like who have a kinky back like that, okay, and then scoliosis. Even human have scoliosis. The difference is spondylolisthesis is a downward rotation, so it's just it become it downward. Scoliosis is to the side. If you notice, even in human, scoliosis, someone with scoliosis usually they like they have like they show like they're not like what do you call it, straighten up. Okay, they're like to the side a little bit. Okay, so that is slightly different, but they can lead to the same neurological conditions. So this is how they look like. There's ventral dislocation of the fourth thoracic vertebrae. You can see here there's a pinching of vertebrae here. Okay, and then usually the affected bird will sit on their tail with feet extended or to the side. What you usually see in the farm, what happen is what you usually see in the farm, they don't look like this. Usually what happens in kinky back chicken, both of their legs extended to the front, and then they just sit like that. Most of the time, if you see spondylosis, both of the leg extended to the front, and they just sit like that. I don't have the picture. I should have put a picture here. Okay. Next one is tibial dyschondroplasia or osteochondrosis. As the name implies, chondro is related to cartilage. Osteo is bone, chondrosis is growth. Okay. Or plasia is like the growth. This is disease. Plasia is the growth problem. So this tibial dyschondroplasia is like abnormal growth of the cartilage. It's a very common growth plate cartilage abnormalities of fast-growing mid-type birds, which leads to the plug of vascular uncalcified cartilage situated in the metaphysis beneath the upper tibial-tarsal bone. It's also related to hereditary problem. The incidence increase with rapid growth without a long daily rest periods and electrolyte imbalance. So if you see chickens that also have some sort of imbalance or lameness problem, one of the things that you should open up, usually what I did is I do a cut surface of the bone. And then this is how they look like, the normal bone. They should have these different parts of the bones. I think this one has been covered in your anatomy as well. You should have a growth plate, cartilage, all these things, diaphysis, metaphysis, all these things. However, in tibial dyschondroplasia cases, what you have seen is the cartilage area become thickened. Okay, you can see this score 1, number 2, score 2 is like slightly thickened here. Okay, and then this is what you see if the most severe one, the plug of cartilage accumulated in the bone. Okay, this is like real cases. Okay, what you see, you do a cut surface of the bone, you see cartilage accumulation in the bone. Okay, that's all. So that's why I'm saying for musculoskeletal disease is quite short. You just have to diagnose it. Sometimes you don't have to do anything. If it's nutritional, you just correct nutritional problem. Sometimes it's a spontaneous problem. There's nothing much you can do, or something. Sometimes it's something that you see once a while, or it happens spontaneous problem in some of the chicken. It's just more like something that you encounter. So next one is valgus varus deformity or VVD or twisted legs. It's lateral twisting and bending of the distal tibial tarsal and proximal tarsometatarsal bones is here. Okay, this tarsometatarsal is this one. Tibial tarsal is this one. Okay, proximal and distal tibial tarsal and proximal tarsometatarsal. Occasionally complete slippage of the gastrocnemius tendon. If in severe cases, there's a tendon here, we call it gastrocnemius tendon, it connects them here. If you have a rupture of the gastrocnemius tendon, they definitely cannot walk at all. Usually unilateral. VVD occurs at older age in turkeys than in broiler chickens, around 6 weeks of age. Slowing growth rate in the first 10 to 14 days will reduce the incidence of VVD. This is related with the growth problem. If the chicken grow too fast, the muscle grow too fast, and the bone cannot catch up, so it pulls, the tendon pulls the bone kind of things. Okay, so it become twisted. So valgus varus deformity. Valgus varus deformity you can also see in human as well. Actually, if you notice some of people, they have like valgus or varus deformity. They walk slightly different. Again, I have a friend with this deformity as well. However, doesn't mean he's not fast. He's one of the marathon runner. It's just slight problem with the leg. What you see is when he wears his shoes usually wear off in the inside part or in the outside part. It's not stable. So that's where the light form lah. In the severe form, you will see differently. Okay, this is how it looks like. Valgus or medially deviated, so it deviates to the inside. Or varus is laterally deviated. Okay, so this is how they look like. Sometimes you don't even notice this in the farm also. So it's just something if you want to diagnose it. In chicken, this is the severe one. Valgus varus deformity, this is a lot severe. or yeah, in chicken. You can see the difference, how they stand, they look slightly different. Okay, that's all on growth environmental related leg deformity, something that over when they grow and then something happen during the growth. The second one is physical and mechanical causes of lameness and musculoskeletal disorders. There's some of it. I will go through one by one. Epiphyseal separation is a result of growth plate pulls away from the femoral head and trochanter of normal young rapidly growing chickens. This is actually normal. When you do postmortem, one of the part, when you do postmortem, before you open the chicken, usually you try to dislocate the femoral bone so that they flat. It's easier to open, or else the leg will stand up towards you. So you want to dislocate it. Sometimes when you do that, there'll be like femoral head dislocation. You actually dislocated the femoral head. This is a normal thing. Okay, you don't assume this is a problem or something. It's quite a normal thing. This is how they look. The femoral head are removed, so you'll see the inside part of the bones. So it's red and something. The only problem, if you open this and then what you see is femoral head necrosis. Femoral head necrosis is different from epiphyseal separation. Femoral head necrosis is when you see a necrosis area on the femoral head. When you dislocated it, there's some necrosis area. Necrotic, it becomes gangrenous or something. This is usually related with septicemic condition, because there'll be some bacteria or something entering the blood, and then it could enter the bones and it leads to femoral head necrosis. In US, one of the factor that leads to total condemnation is femoral head necrosis. When they do that, they see the femoral head necrosis, they will condemn the whole carcass. So they just remove away the whole carcass. It's just some example lah. Second one is fractures. This is something that you will commonly see in the farm. Okay, usually in free range and perching hens. Hens with osteoporosis are usually prone. Usually hens, layer chickens. Layer chickens are very prone to fractures because during the peak production, they need a lot of calcium. And then when they didn't receive enough calcium from the feed, what they have to do is they have to absorb calcium from the bones. And then they have a high tendency to have fractures. So in chickens or hens, laying hens with a lot of fracture problem, you may want to consider adding more calcium in the feed. Often occurs when the birds are sent to processing. Sometimes this happens during catching itself. Okay. Sometimes if you have a rough handling when you are catching the chicken before you send them to slaughterhouse, they can also lead to a lot of fracture cases. Turkeys that are often overly heavy may suffer spontaneous fractures in the femur, often related to calcium deficiency. So this is an example. This is a normal bone, supracondylar fracture. Usually, if a fracture happened in the farm at any age, what happened is most likely you didn't notice it, and then they will heal by itself. And when they heal by itself, you will see when you do a postmortem or after the harvesting and processing, this is how they look like. They heal up. It's just when they heal up, you can see the head here is already healed up. Actually, there's a fracture here. Okay. So again, same here. Distal tibiotarsal supracondylar fracture. Fracture at this site causes severe valgus leg deformities. If you see the picture here, the leg will be pointed this way. So go to the side. It will heal. It's just that it will look like slightly different. Spontaneous fracture of turkeys. If you do hatching, it's normal to see a lot of fracture cases. If you see too many fracture cases at the processing plants, you may want to advise the farmer or those doing the catching process to be gentle on the chicken next time, because fracture cases will lead to partial condemnation. You have to remove some parts of the body parts, and then it's a waste, because you don't want to sell chicken with fractured legs. Because most of the time, if you have fracture, there will be a lot of bleedings there, and then it's not nice to be sold on the market. They don't look good, and then it's wasted. Next one is exertional myopathy. is muscle activated induced myopathy. If you have heard this in horses, you probably will hear this when you are taking equine medicine. It can also happen in horses. We will call it Monday morning sickness. Okay, due to accumulation of metabolic byproducts, lactic acid or muscle hypoxia, causing muscle and vascular damage. It will lead to formation of edema or blood transudate, leading to the swelling, degeneration, necrosis, and mineralization of the muscle fiber. Basically, what happens is if you suddenly chase them or suddenly exaggerated, it's called exertional myopathy. All these big chicken, especially all the broiler chicken, they all like what they do is usually eat and sleep, eat and sleep. That's all what they do every day. And then if you suddenly go into the farm or during the hatching day, and then you chase them, and then they have never exercised throughout their life, and then they have to suddenly run away for their life, and then you exaggerate the muscle too much, it leads to this problem, edema and blood transudate formation. And then they just drop, okay? Because it's like, they look at this. Okay, this less severe one, you see some hemorrhages. In a lot more severe one, you'll see edema of the whole drumstick here. Okay. Next one is deep pectoral myopathy. It is also related with exertional myopathy, but instead of the leg area, it happens at the pectoral muscle. It caused by excessive wing flapping and myositis. Ischemic necrosis due to inadequate blood supply of variously sized deep pectoral muscle groups. Okay, usually happen in heavy chickens or broiler chickens at the processing age. And the broiler chicken at the processing age where they are very heavy, the breast muscle is big, and then if they overflap their wing, what happens is the deeper muscle, the deep muscle does not receive enough oxygen. Okay, ischemic necrosis. If to understand this, for example, if you want to if the chicken want to flap their wing, they requires contraction of the breast muscle. It's same principle as in humans. Okay, if any of your classmates is going to gym often, if you want to increase your chest size for those always go to gym, if you want to increase the chest size, what you have to do is you have to do the push-ups or you have to do the press. Okay, dumbbell press or barbell press. So by moving your hand, okay, and then giving a lot of pressure while you actually contracting the breast muscle. Okay, so that's how you increase your chest size. So same with chicken. If they want to flap their wing, they require movement of the chest muscle, the breast muscle, and then excessive wing flapping when they want to chase when you try to chase them during processing during transportation before processing, where they overflap their wing, and it leads to the ischemic necrosis of the deep muscle. But the lesion that you'll see is degeneration, necrosis, fibrosis of deep pectoral muscle in the heavy meat chickens. Most economic loss result from downgrading or contamination at processing plants, because if you see this, you have to do a partial contamination and you have to remove the whole breast muscle from the chicken, and then you can only sell the other parts to the market. So this is a big of economic losses because breast muscle is the biggest meat in chickens. So if you remove the breast muscle, you probably lose half of the chicken weight already. It's also known as green muscle disease or Oregon disease. So this is what happens if you open the breast muscle at the deep area, you see it looks like greenish discoloration on the deep muscle. So you see here. That's why you call it green muscle disease. Okay? The breast muscle, this is the keel bone. The breast muscle become ischemic and then necrosis. Okay. And then for deep muscle pectoropathy, you have to differentiate it with vaccination side effects, because if you want to do what do you call it, intramuscular injection of vaccine, you also inject them at the breast muscle. You also inject them at the breast muscle. Sometimes it causes also cause necrosis of the area of the breast muscle. If you have a contaminated needle or something, you will have some caseous material inside there. So you have to differentiate it with vaccine problem. Okay. Next one is rupture of the gastrocnemius tendon. It's a very common lesion in meat-type chickens, particularly in heavy broilers and broilers and turkeys. The rupture is usually primary and caused by excessive weight on the tendon, usually related with the weight problem. The chicken are too heavy. Viral arthritis is rarely a predisposing factor. Viral arthritis caused by reovirus can also cause rupture of gastrocnemius tendon. Bilateral ruptures are common. You may see a lot of both sides ruptured. Hemorrhages from the injury is visible as red, blue, or green discoloration on the tissue above the hock on the back of the leg. If it's red, usually is something that happened recently, new hemorrhage, and if it's green, probably it happened quite some time ago. So this is what happened: is gastrocnemius tendon rupture. Rupture of the gastrocnemius tendon will lead to the hemorrhages on this area. Even without removing the chicken, removing the skin, you will see discoloration of this area. You suspect and the chicken cannot stand, most likely is rupture of gastrocnemius tendon. See again, without removing it, you will see discoloration of this area. Okay, most likely the chicken is suffering from gastrocnemius tendon rupture. If it's greenish like this, most likely it's been a while. And then rupture of gastrocnemius tendon is sort of permanent. You cannot really heal. So the chicken will be like limping for the rest of their life. Next one is pododermatitis and foot ulcers. Result from irritation by feces or wet litters, causes an increased amount of keratinization and discoloration of the foot pad and hock. This lesion can become infected, leading to painful lesions. Prevention is by maintaining a good quality of litter, and this condition predisposes turkeys to lameness. Pododermatitis or foot ulcer can be seen in chickens as well as in pet birds as well. Okay, this is a common problem if you have dirty. It usually happen in deep litter system, because deep litter system is the defecate on the litter and then it accumulates over time. And then sometimes the amount of litter is too much. The ammonia problem will irritate the foot pad, and then causes irritation and then thinning of the area, and then if they get infected, leads to ulceration. So this is some of the example. It's some of the case that you will see. Thickening of this area in some cases. And then this one is much more thickened. I've seen, if you go, there's one duck farm, Payajaras before, they have a very severe pododermatitis problem. It's like literally all the ducks there literally walking on bumble foot. It's like one huge lump of the under the feet. If they get infected, you'll see is ulceration on this area. Okay, ulceration on this area. Sometimes you got ulcer, you get infected, gangrenous of the digits. Okay, these some of the things. So it's quite easy. If you have a lot of cases with pododermatitis, you may want to revise the hygiene problem, and then check if they have any problem with litter, if it's too wet, or if the area, the surface is not good condition for the food. Okay. Next one is shaky leg lameness or shaky leg syndrome. It's most common in male turkeys 8 to 18 weeks old. Leads to severe lameness. Turkeys reluctant to walk or rise. The etiology is not really known. Can lead to painful pain result from tendinitis, often a secondary result of pododermatitis. Prevention is again, since it's pododermatitis, good litter condition. You probably will not see this because we don't have a lot of turkeys in Malaysia. But this is how they look like. This picture, they're reluctant to stand. But if they try to stand, is what happen is they will like shaking. Like shaking. It's like old people trying to stand up. It's like they shake, all the legs shaking. Okay, that's why it's called shaky leg lameness. Next one is rotated tibia. It's outward rotation or torsion of the shaft of the tibiotarsus. The foot ends up pointing laterally or backwards. Hot joint is normal with no displacement of the gastrocnemius tendon or bending of the distals. Bone is straight and strong and is usually unilateral, frequently in turkeys 2 to 14 weeks old, caused by poor footing and slippery floor. So basically what happened is the chicken just have a rotated tibia. Or the turkey will have rotated tibia. The leg is just pointing outwards. If you see here, look at the bone, the normal bone is look like this. Okay? And then rotated tibia is just twisting. There's no it's not a fracture or anything. The tibia just rotate to the side. Or the head here is like rotate to the side. So the leg will pointing this way. Okay, it's a rotated tibia. This is something that you spontaneous thing. It's not a problem if you see this. You can still eat the chickens or the turkeys. They will grow normally. It's just something that you'll see. Next one is toxic causes of lanier. I'm not going to cover so much on this because there's a lot of toxins that can affect the nerve, muscles, and bones. This some of it. Okay, toxin that can affect the nerves is like arsenic acid, organophosphate, or poisoning, especially in if you give organophosphates in the feed to control some problems. Lead, mercury, and selenium. Too much of this ionophores, especially in coccidiostats and botulinum toxins can affect all this. I've covered botulinum toxin before. Toxin that affecting the muscle is also ionophores can affect the muscle, certain plants, and selenium toxicity can also affect the muscle. Toxin affecting the bones like fluorine excess, but it's very rare. So I'm not going to cover all this. It's just some examples. Plus, toxin problem rarely happen unless you really have problem with excessive usage of something or accidentally overdose on coccidiosis. Okay, it did happen. For example, in this case happened before, we call it knockdown syndrome, ionophore, which is a Coban. Toxicity in male breeders leads to the mortality of 93% in 24 hours after feed delivery. So this is a problem lah if you accidentally overdose the animals. Okay. And the next one is nutritional deficiency. This is one of the common things that you will see in the chickens. And this is something that you can control because it's something related with nutrition. If you accidentally deficient on something or excessively give on something, it will lead to this nutritional problem. This is important because it's something that you control and usually happen. First one is rickets. Diet associated with deficiency of calcium, phosphorus, vitamin D, calcium and phosphorus imbalance. What happened is they have a unique appearance, soft rubbery bones and big, which is the failure of the calcification of the hypertrophic cartilage. Enlargement of tubercula and capitula of the ribs. Tubercula and capitula of the rib is part of the anatomy of the ribs. Capitula and capitula of the rib is part of the bones that is attached to the spine. Okay, if the rib is attached to the spine, right? Our rib attached to the spine. The bone that attached to the spine is the tubercula and capitula. Common between 2 to 3 weeks of age. Clinically, what you'll see is reluctant to rise and unsteady gaits. So this is how they look like. If you got their deficiency of calcium or phosphorus, vitamin imbalance, the bones become rubbery. You can bend the bone and it didn't break. And then this is the enlargement of tubercula and capitula of the rib. This is something that you'll see in rickets cases as well. You see all this enlargement here? Okay. Enlargement here, at the attachment here. Even this one is that, or the rib itself is enlarged. Okay. And then here, you can bend the beak as well. You can bend the beak, it become rubbery beaks. So if you do a post-mortem, you do a cut surface of the bone, you'll see different things. So if vitamin or calcium or vitamin D rickets, you will see widened zone of the proliferation. In the bone, you have a proliferating area and hypertrophy area. And then if it's a phosphorus-related ricket, is widened zone of the hypertrophy. The hypertrophic cartilage area become thicker compared to this one. This one is proliferating cartilage become thicker. Okay, next one is osteoporosis. Okay, cage layer fatigue. We call it cage layer fatigue because usually happen in cage layers. The the laying birds that is put in cages, because those put in cages, battery cages, they only have access to whatever feed given to them, because usually in one cage you have like 5 6 chickens in one cage in layer chickens. So whatever food you give them, this is whatever food that they get. They live in that confined space area only. Vitamin D, calcium, or phosphorus deficiency or imbalance, usually seen in high egg production of layers, usually peak production. Withdrawal of calcium from skeletal from the egg production, like I told you earlier. Restriction of movement in the battery cages is one of the factors. When they have in battery cages, they have very limited movement. They can only move like few cm away from the area. Bones become extremely thin and brittle. So what happened is you'll see posterior paralysis. Usually in cage layer fatigue, usually what happened, you will see all these chickens that are suffering from cage layer fatigue, they lie on their side. They lie on their side with brittle, fragile bones, thin cortices, and sometimes fracture. One of the way you want to check cage layer fatigue or osteoporosis is, what I do is, if you have seen a lot of cases with posterior paralysis, I do postmortem in one of them. I'll try to break the bones. Okay, use your finger. I just break the bones with my finger. Usually, in a normal bone, it requires a lot of strength to break the bone. But in case of osteoporosis, you can just break it with your finger. They are very fragile. Common fracture sites are the keel bones, tibia, and the humerus. Sternum often deformed in folding of the ribs at the costochondral junction. At the rib area also, because the rib is also bone, it can fracture at the rib area as well. You see, if in cage layer fatigue also, one of the way, if you do a postmortem on very old birds, if you see the many of the birds having as S shape, I have here, I don't have it here, S shaped keel bones. The keel bone is supposed to be straight, right? If you have a S shaped keel bones, what happened is most likely during the peak production when they were young, they have cage layer fatigue. It called fracture of the keel bones, and then when they heal up, the keel bone is not straight anymore. It become S. Okay, then you know that during when they were young, they were suffering from cage layer fatigue. Prevention is adequate calcium, phosphorus, and vitamin deficiency. So let me ask you, both of these, osteoporosis and rickets, both are the same issue, calcium phosphorus deficiency. But why this one is causing ricket and why this one is causing osteoporosis? What's the difference? The difference is rickets is a developmental issue. So basically, usually happen in birds that were young. They do not receive enough calcium to develop the bone. Okay, to develop the bone. When they don't have enough calcium to develop the bone, what happens is replaced with cartilage. When it's replaced with cartilage, the bone become rubbery. And in osteoporosis, the bone is already well developed. It's just that because they don't receive enough calcium, it reabsorb the calcium from the bone, and then they will have a fracture cases. So it's the opposite. Both of them are due to same problem: calcium, phosphorus, vitamin D deficiency. But one happen at a young age because they don't have enough calcium to develop the bone. One is they happen at older age. The bone is already well developed, and then they absorb the calcium. One hard to break, one easily fractures. So because the rickets is replaced by cartilage, the osteoporosis, it leads to the fragile bones because they absorb the calcium. So the same problem, different age, different manifestation. So this is how they look like: posterior paralysis, enfolding ribs of the costochondral junction. You can see here the rib area here. You see enfolding of the ribs. The rib is not straightened up. You see, the rib is some fracture area of the ribs. Okay, next one is parosis or chondrodystrophy. Is due to long bones become shortened and thickened, bending of the tibia and metatarsal bones may have displacement of gastrocnemius tendon at the hock, usually related to choline or manganese deficiency. This one also, honestly, I've never seen this myself. I think we rarely have this kind of problems. And then even we have this kind of problem, it usually goes underdiagnosed. Okay, unless you see a lot of cases like this, then you may want to consider doing fit analysis for choline and manganese deficiency. Okay, cirrhosis, chondral dystrophy. Next one is riboflavin vitamin B2 deficiency. It leads to the formation of keratoparalysis. This one can happen. Is not that rare. It can happen. Riboflavin deficiency. What happen is all the birds will have a curl toe. All the toes become curled and then to the become goes inside. If you have you see this a lot in the brooder stage. Okay, and in your chicks, you may want to consider giving vitamin B2 in their feed. Next one is articular gout. It's associated with excessive plasma uric acid levels and subsequent deposition of monosodium urate in joints and tendon tissue. Hereditary defects in uric acid metabolism or that affect excessive proteins. Articulation become impaired, especially in the region of the foot and hock, and leads to the formation of lameness. Is related if you have excessive plasma uric acid level, a lot of problem can lead to the gout problem, especially if you have kidney problem. Sometimes dehydration can also lead to this problem. What happens is they form a lot of uric acids, okay, in the joint area. Most of you are still young, probably have never suffered from gout. Gout is one of the most painful joint problem. Okay, joint problem. It's like really painful. Even when air blew on the joint area, it's so painful. Okay, I had it once. Okay, it's the acid problem. Probably I ate too much seafood or something. The articular gout is the joint problem. We also have visceral gout. I think I've covered visceral gout before when the formation of uric acid in the visceral area. It's the same thing, uric acid in the visceral area. All this white thing, okay, yeah, the uric acid. How do you diagnose this uric acid? First of all, if you see grossly, the the look is like quite prominent. They look like chalky materials, like chalk, sandy. And it look like a lot of sands inside this area. It's like sandy because of these crystals. And then if you look under the microscope, you can see all the uric acid crystals. Okay. Next one is muscular dystrophy associated with vitamin E deficiency. I've covered this before. Muscular dystrophy or vitamin E deficiency, because vitamin E deficiency leads to 3 manifestations. One of it is encephalomalacia, muscular dystrophy, and the exudative diathesis. So this what happen, degeneration of the muscle. The muscle fiber degenerate and you can see all these white streaks. And you can check the gizzard also become whitish area because of the muscular dystrophy. I'm not going to cover this because I've covered this in the previous lecture. Okay, last one. Infectious causes of lameness. Infectious causes of lameness, there's a few, virus and bacteria. The virus I'm going to cover here, viral arthritis and osteoporosis, and bacteria we have mycoplasma and some staphylococcus. Viral arthritis or tenosynovitis due to reovirus. Okay, reovirus is one of the diseases that we also have in Malaysia. We also vaccinate against them. I think your senior probably will present about reovirus next week in one of the rounds. You may want to attend it. Okay. Subclinical, it can happen subclinically or clinically, characterized by reluctance to walk, poor growth rate, and poor food conversion. Reovirus are well known to cause viral arthritis as well as poor, stunting and runting syndrome. They just didn't grow well. In case of viral arthritis, you'll see is swollen joints. Okay, and if you do open the joint area, you'll see fluid, purulent discharge in the fluid area, and sometimes it leads to the gastrocnemius tendon rupture. It's a gastrocnemius tendon, it ruptured here. Okay. This is again arthritis, serous-gangrenous synovial fluid in this area. If you open the joint area, the swollen joint, you'll see a lot of fluids inside this area. Due to reovirus. And to diagnose it, you may want to send for PCR And you can also do virus isolation. Okay. Next one is osteopetrosis. Osteopetrosis, most likely you will probably never see this at all. It's not very common at all. Is the disease itself is not very common, and that is uncommon manifestation of the disease. Okay, it's uncommon manifestation of avian leukosis complex. Cortices of long bones of adult chicken become greatly thickened, also known as marble bone disease. What happens is you'll see the shank, the leg area become thickened. Okay, the leg area become thickened. You can see the long bones here become thickened. We call it bootleg shank. Okay, bootleg shank. Okay, the shank become like a boot, look like a boot, is become thickened. Okay, it's due to avian leukosis complex, avian leukosis problem. If the disease has been infecting the chicken for too long, this is what happened. Okay, next one is Turkey syndrome 65. It's first encountered in Britain in 1965. That's why they call it Turkey syndrome 65. Due to is a disease caused by Mycoplasma meleagridis. Is one of the disease. What is the manifestation of Mycoplasma meleagridis? Mycoplasma meleagridis is a mycoplasma that affecting the turkeys, which causes stunting, poor feathering, and skeletal abnormalities in turkey poults. What you see is both legs and swollen hocks. This control one, you can see the infected one here. Okay, the legs both a little bit and then slightly swollen. So it's again swollen leg, bowing. The bowing is like virus deformity. They deviated laterally. Okay, yeah. Again. Yeah. This, if you work in poultry producing countries, you may see this in turkeys if they get infected with Mycoplasma meleagridis. I think this is the last one. Bacterial synovitis or osteomyelitis or arthritis, usually due to hematogenous spread of Staphylococcus aureus or E. coli and several other bacteria. Common in all species of poultry. Clinically, they're just reluctant to walk and weight loss. Osteomyelitis develops only in growing birds with active growth plates. Synovitis more frequent in growing birds, but seen also in adults. So what happens is, you have swollen joints, osteomyelitis. You open the bone area. This is arthritis. This is a bone, or if you open the bone area, there's a hematogenous infection. Okay. If you see hematogenous infection like this, especially in processing plant, this is an indicator for total contamination because it's an indicator for septicemia. If you see osteomyelitis, for example, infection in the bone, you have to condemn the whole chicken. Okay, you throw away the whole chicken. This is a criteria for total contamination because septicemia is criteria for total contamination because you don't want human to eat a septicemic chicken because they have bacteria all over their body. Okay, spinal abscess is one of it due to Enterococcus faecalis. Spinal abscess. Okay, that's all. Any question? I think it's quite a lot of diseases to digest, but not much information for each disease lah. Okay, it's quite easy to memorize for the less disease, but I think it's quite straightforward and not much information of it. It's just you probably have to know what causes it, what is probably the causative factor, and then how to control it due to some of it lah. Okay, if you know what causes it, you know how to control it. For example, dick petromaty is due to excessive flapping of the wing. Maybe it's related to the chasing or something. Then you control it while do a proper harvesting problem. So rupture of gannets management. If you know what causes it, you know how to control it. That's as easy as that. Okay. Okay. Do you have any question on this topic? I think.
Morning, doctor.
Yes. Who's that? Dwayne.
Doctor, if the chicken is infected with virus or bacteria, can we still eat the chicken?
Can you eat the chicken? If it's a virus, most likely you can eat the chicken unless it's avian influenza. Any virus is okay. You can eat the chicken, no problem. But if it's bacteria, you can you have to indicate what kind of bacteria. Usually you don't eat lah. There are certain indicator that you don't want to eat the chicken. If you see they have sort of like septicemic problem, congestion, everything, definitely you cannot eat the chicken lah. For example, E. coli, salmonella, all those things, because it can cause food poisoning or food toxicity to you also. It can infect you. It's just that I don't really worry about Malaysia situation, because in Malaysia, what happened is all our food are well cooked. Okay, we are not like Western countries where they eat rare meats or kind of things. Okay, we cook it deep fried, or sometimes we cook it in rendang where we like cook it for hours. All the bacteria will die. So I don't have any issue with that. I don't think you will have. That's why we rarely have like food poisoning problem or food poisoning problem in Malaysia because of that. Usually what happen is food poisoning problem happen if people doing barbecue. Because if you notice in barbecue cases, many cases you undercook the meat. If you, especially in the lake area or something, if you open up, there's still rat and then some of the meat is not undercooked. It can cause food poisoning lah. But I don't really worry about in Malaysia situation. Even eggs. In Malaysia, we cook our eggs like really well. We don't eat raw eggs. So yeah, that's not a problem.
Okay, thank you.
Okay. But if you see some of these hematogenous infection, septicemic condition or something, don't eat the chicken lah. If you see the liver also have necrotic spots and everything, the liver is look different, you don't eat the chicken lah. Okay, just to be safe. Because usually in the liver, if the chicken have bacterial problem, usually it appears in the liver also. And the liver will look enlarged. Enlarged liver is not a good indicator. You don't want to eat large liver. Eat the small liver. Small liver is a good liver. Large liver is not a good liver. Okay. What else? Wait, I need to check the chat. Okay, any other question? Anything? Okay, just to haze out for this one, because not much disease on this one, I will cover most of this musculoskeletal disease in test 2. Because there'll be a lot of pictures and whatnot. Because it can be a very short notes on each of the question. I will cover most of it. I probably will not cover it in final. We'll see lah. I don't know. I haven't set the final exam question yet. Maybe I can cover in final also, but most of it will be in test 3. Okay, any other question? If not, I was informed that you have class after this. Okay, that's all for today. Today is Friday. Have a good weekend, everyone.
Thank you, doctor. Have a great
Thank you, doctor.
Thank you.
Thank
Stay
you,
safe.
doctor.
Thank you, doctor.
Yeah, doctor.
Thank you. Thank you.